Hi there. My
Hi.
name's Luann Lonergan and I'm a registered nurse, and I'm just going to be performing an assessment of your hair, the skull, and the face. Can you
Okay.
tell me your name?
My name is Lori Hurdle.
All right, and can you tell me your birth date?
3/8/19.
All right, very good. Well, Lori, I'm going to put on some gloves and I'm going to ask you just a couple of questions. Have you had recent chemotherapy at all?
No.
And how about, do you have any thyroid disorders?
No.
Okay, good. And how about, I'm just looking at your eating. Have you had any protein deficiency eating at all?
No.
Those might be some conditions that could affect the hair that you have. So I'm going to just put those on, and as I'm putting on my gloves, I'm just taking a peek, and you've got very nice hair that I'm looking at right now. It looks like it's even on both sides when I'm looking at that. Let me just take a minute to put on my gloves. There we go. I don't see any areas that it's missing or sparse, so I'm just looking at that. The texture, it looks very resilient and silky. It's not dry, it's not brittle. Again, I don't see any areas that it's absent. It doesn't appear too oily. It doesn't appear, again, too brittle. I'm going to take a peek here and just look at, when I'm going inside here, if there's any infections or any lice or nits. Sometimes they like to go behind the head. I'm going to go here or behind the ears, and I don't see any of that here. Good. So that looks very nice. So your hair looks real good. Alrighty, then I'm going to look at your skull, and just taking a peek here, things look very good, symmetrical, side to side. Your head looks rounded. There's not anything protruding, and I'm going to just palpate a little bit here and let me know if there's. And have you had any recent injuries that you clonked your head or anything? I'm not feeling any masses. Nothing's tender at all. Beautiful. I'm just looking at your eyes, and they look in good position. They're opening up. Both eyes open up about the same amount. I'm looking at some of these smile lines are on the same from side to side. And if you want to close your eyes a bit, there's no swelling around her eyes. You can open them now. There's no sunken in of your eyes at all, so that looks very good. I'm going to just have you perform a couple of tests. I'm going to have you smile. Good, and that's symmetrical side to side. I'm going to have you frown. Poof out your cheeks. Alrighty, squint your eyes. Beautiful. And again, I'm looking side to side, and things look very well there. So I'm just going to take a peek at your hair on your arms, and there's just a little amount of hair, and they're on both. So that looks very good. If there would be excessively hairy, or on your, again, I would also check your legs too. Those look very good. And just noting, elderly people sometimes have coarser eyebrow hair, nostril hair, and ear hair, and that would be a normal finding.
Okay.
Do you have any questions at all?
No.
So that would be assessing your face, your